It is time for Help Monday, of course, brought to you by Marble City Pharmacy. Jacob and Jared Johnson here with us this morning. Gentlemen, good morning to you.
Good morning.
Good morning.
I guess the first question, a lot of people are asking, got out of rhythm a little bit with the storm and the snow and didn't have electricity and all that kind of stuff. And what do you guys expect today, and how did you guys adjust to the storm?
Well, we did get out of the rhythm. I guess everybody was out of rhythm. On Friday, we actually closed at 5, which was good because almost everybody else was gone long before then. I worked the last 2 or 3 hours by myself. We had some problems with the internet.
He's a martyr.
Well, you know, somebody,
Take it with the team, you know.
somebody had to do it. You know, you always got your concerns in a situation like that because you got people that need the medication. And so it even affected us into Saturday. Daniel was able to open up the pharmacy, but I don't think he had internet till 10 or 11. So you kind of had to work around the insurance issues and all that stuff just to make sure people have what they need.
So, Jacob, how would you tell people or talk to people this morning about, man, I've got to get up there and I got to get my prescription filled? There's probably a lot of people thinking that same thing this morning.
There are, and you know, to that we say,
come on,
bring it on. You know, yeah, we'll be busy this morning, and it will be hectic this morning. So if you don't have a dire need and want to wait a couple hours, that's fine. But if you do, you know what, we'll be there, and we'll do the best we can, and we'll take care of everybody that needs taken care of.
We think we have power. We'll find out in a few minutes. Yeah.
As far as we know, we're running at full speed. So far as we know.
How many times have we heard someone describe their sickness? I got the cold or flu or something. It's cold and flu season, but there are really some differences between the two.
There are some differences between the two. First thing we probably talk about is what causes them. Colds, they're both caused by viruses. Colds are caused by a bunch of different kinds of viruses. Rhinoviruses would be the most common, but the flu is caused by the influenza virus. There's a number of different strains of that, as you guys have probably heard before. So they are viruses, not bacteria. That'll be important as we go on with our story.
And are we still giving flu shots now?
Oh yes, of course, still giving flu shots. You know, an update on that this year. You know, in case somebody saw them, there's some initial reports earlier this year questioning the accuracy of this year's flu shot. It changes every year, and they were not good, but the CDC has come out since then and said, hey, those reports are based on some things in Australia that we don't think are pertinent to us right now, so hold off. We still think ours is good this year. Keep getting them.
Okay. Are there different symptoms of cold versus flu?
Oh yeah, absolutely. But first, let's start with this. There are mostly similar symptoms between the cold and the flu. Persons have sore throat with both. They have all kinds of nasal congestion and cough with both. They feel a sense of fatigue or malaise with both. If you had to try to pinpoint a difference between the two, you may just say that with the flu, you seem to feel a lot worse. And a lot of times people who have the flu just don't want to get out of bed. Maybe their body's aching so bad. So you may have the same set of symptoms, but the severity is usually a lot worse with the flu.
I saw this morning where a child had one of those or suffering one of those and had a temperature of 103. I mean, it can be very severe.
Absolutely. And when you're talking children and the more aged among us.
I love it when you say that.
Yeah, you know, I try to find a way to say old folks now. You know, it's much more big deal. Also can be harder to tell the difference because a child is going to run fever if they're sick regardless, just about. You know, you get a middle-aged healthy adult, you got a lot of fever, it's going to be the flu more often than not. Child, it's harder to tell the difference, but when you've got flu involved with children and older adults, there's a lot more complications that can come. It's a lot more serious deal. And so you have to, that's why it's important to try to know the difference and tell, do I need to run to the doctor or not? Because it can be a big deal in the either end of the spectrum.
Yeah. What about the longevity of either or?
That's a good question. When you're talking about the common cold, you're usually talking about 7 to 10 days. And the flu somewhere in that range, although some people can be sick 10 to 14 days, somewhere in that range. So they kind of overlap, but 10 days to 2 weeks, somewhere in there.
The primary concern with longevity, the difference at least between the two, is how long am I contagious? You know, common cold, every bit as contagious, but only 2 or 3 days. And it's 2 or 3 days when symptoms appear. That's when you're most contagious. Those 2 or 3 days after symptoms appear. The flu, you're most contagious 1 or 2 days before you know you're sick, because it incubates for a while. So you're most contagious 1 or 2 days before you have the first symptom, and then for another 5 to 7 days after it. So they're equally contagious, but flu is a lot longer contagious.
I've heard stories of entire families being stricken with the flu, and it's just an awful time.
It can definitely happen to wipe out your family for a while, but as we talk about the severity of the flu, this is the big deal with the flu shots. You ask the question all the time, why are y'all making such a big deal about flu shots? Why are you making such a big deal about preventing the flu? If you look at flu and pneumonia together, this is not a joke. They are the 8th leading cause of death in the United States. And so persons who have the flu, particularly persons who are older, are much more susceptible to being put in the hospital for the flu. They're much more susceptible to that flu turning into pneumonia. And as you know, those things can be deadly, particularly the older we get.
How do we prevent it, or can we?
Well, lots of things. Okay, first of all, let's start with something, and then, this will give some credence. I make no money off of this. Wash your hands and stay away from people that are sick. Let's start with the two most obvious. Keep your hands clean and keep yourself away from contagious people as best as possible.
And that goes for the cold and the flu.
Yeah, if you're the one that's contagious, don't spread it to everybody. But then we're talking preventing those flu and pneumonia deaths that Jared was just talking about. Yeah, get the shot. Even if it's not 100% effective in any given year, it greatly reduces the severity of the symptoms if you do end up getting it, and the chances of it turning into a hospitalization and pneumonia, and then obviously much worse than that as we go. So the prevention, cleanliness, distance, and again, the vaccine is very effective in preventing the worst outcomes.
And it's very difficult. People in the workforce, they're sick, but they got to work. And sometimes we affect the workforce with a sickness. The
flu is one of the major causes of missed work days in the United States, and that's why we go out to businesses actually and do flu shots on site. It's one of the best way, one of the most cost-effective things employers can do to save those missed work days. It costs them a bunch of money too.
Yeah. People who take flu shots, and we're talking about that pertaining to cold and flu season. People who take the flu shots, are there side effects from taking a flu shot?
Oh, horrible! Grow an extra arm. The leg may fall off. We hear all kinds of stories. No, that's as likely as some of the stories we hear. You get a vaccine, any vaccine, you have a chance of having a vaccine reaction, which is generally something along the lines of, I felt a little stuff, you're a little sick or a little off for the next day or so. I may have a spot on my arm where I got the shot that itches a little. Severity, no. You're not having severe reactions to vaccines, in the 99.99% of the time. Again, maybe a little localized reaction, swelling or itching on the spot, maybe a little stuffiness or malaise the next day. But again, that all goes away very quickly.
How effective is the flu shot from you getting the flu?
Well, this year it remains to be seen. Some years it's up to 75, 80, 90% effective. Some years it's in the 30 or 40% range. I think Jacob kind of alluded to this earlier, though. One of the great things about it is, even if it's not 100% effective at keeping you from getting the flu, if you get it, you won't be as sick had you not gotten the vaccine. And you have a much less chance of transmitting it to somebody else. For somebody that's like us, who's a healthy younger person, we're going to get the flu. It's not going to kill us. But if we turn around and go give it to our grandmother, somebody who has a lot of chronic diseases, we've done something bad.
Cold or flu, how are they treated?
Very similarly, because in each case, it's a virus, which means in each case, antibiotics do nothing other than add a pill to take and add a copay you had to spend. We treat the symptoms, and that's all you can do. Let's start with things that, again, I'm telling you this is a public service announcement. I make nothing off this. Rest, hydration, drink a lot, keep your fluids going. But then let's treat the symptoms, whether it's sore throat, runny nose, stuffy nose, cough, whatever. You treat symptomatically with over-the-counter things. And again, if it's the flu, you can go, if you're tested and have the flu and it's within a certain time period, they can treat you with an antiviral called Tamiflu that can prevent you from getting worse, help the disease heal faster. make you less likely to transmit it to your family, things of that sort. So we do have a prescription for the flu if you catch it early enough.
But there are a number of over-the-counter medication you can take.
Oh yeah, honestly, right now we're spending a very, very high percent of our day answering questions and making recommendations for over-the-counter products because, let's face it, when you're coughing, when your nose is stopped up and you can't breathe, it's totally aggravating and you just feel awful. So, come to the pharmacy. We'll help you find what you need that's right for you.
When do antibiotics come into play with the cold or flu?
You know what? They do. I don't want to come across as saying they don't. They don't cure the cold or the flu. But when you have the cold or the flu, you are more susceptible to developing a bacterial infection on top of it. You know, obviously the most severe we're talking about here, pneumonia, but not everybody gets that. You know, a bacterial cold or a bacterial bronchitis or something can come with the viral cold or the viral flu. And so then at that point, you know, you go see your doctor, and if they determine that, yeah, you do have a bacterial infection on top of your viral cold or viral flu, then we're going to take antibiotics. But short of that, you wouldn't need them.
You touched on a little bit earlier about the older America being affected sometimes more severely with symptoms of the flu. Who are other people that can be affected by the flu, and how severe could it be?
Well, everybody of every age is susceptible to the flu. It's transmitted just like any other virus. You come in contact with the virus with your hand, maybe a doorknob, maybe you shake somebody's hand who the virus is present on, and then you touch your hands to your nose, your mouth, or your eyes, and it's transmitted to you just like that. And so everybody can pick it up. However, when you have kids who are in child care, who are not old enough or don't understand, or their cleanliness habits are not as good, they're certainly more susceptible. So anybody of any age, but young kids, older Americans, people whose immune systems are weaker. And that's why one of the things for prevention we talk about is, as if you can do this, keep your level of stress as low as possible and get as much rest as you can, because as you do things that don't take care of your body, as you live life and not take care of your body, your immune system gets weaker and weaker and makes you more susceptible to picking up any kind of transmitted disease.
I've heard people say recently, I've got the cold or flu or something, but I'm just gonna wait it out. It'll get better. I'm tough.
The answer to that is it will get better, whether you're tough or not. You know, the flu will go away eventually. The cold will go away eventually. It's a matter of what happens in between then. If I'm in a more susceptible group, young, old, something wrong with my immune system, I got other diseases I need to think about, asthma, COPD, whatever, then you might not want to wait it out. You might want to go get it checked, go to the doctor, talk to the pharmacist, whatever, find out, do I have the cold? Do I have a flu? Do I have something more severe? Am I developing pneumonia? The things you need to find out. You know, your average 35-year-old healthy adult think you may have the cold. It's okay to ride it out a little bit and see, make sure it doesn't get worse. But, you know, if you fall on one of the far ends of the age spectrum or have other conditions going on, you don't need to try to be a hero there and wait it out.
Yeah. A lot of people say, hey, I went to the doctor and I caught the flu. You know, everybody's going to doctors and medical professionals and that kind of stuff. And there's all kinds of ways you can pick up a flu or a cold in a place like that even.
You do run the risk if you go to the physician's offices. A lot of people are there who are sick. A lot of physicians will have different waiting areas. These are for the well people, these are for the sick people, and that sort of thing. And so, yeah, the risk is there no matter where you go. If you have to go to the physician, then you should go. But if it's a simple common cold, generally speaking, you don't have to.
All right, sounds good. Thank you both for being with us this morning. Before we go, it is a holiday season.
So I've heard.
I mean, you got a beautiful gift area there at Marble City Pharmacy too.
We do, and Beth has done a great job getting that ready for Christmas and getting it ready to sell all the wonderful things she finds. You know, there are things we know a lot about and can talk a lot about. But we have to delegate.
Christmas music.
Yeah, we have to delegate when we have no idea. And Beth handles our gift department beautifully. She gets stuff out there. There's tons of stuff for everybody on your list. You need to come look at it.
Well, the Medicare sign-up is gone. Is that correct?
Medicare sign-up is gone. It is. December the 7th was the deadline.
Okay. And how was the response with you guys?
Let's just say that I barely got the consultations done. We had so many requests. So we finally got them in at the 11th hour. But I think everybody's got their recommendations. They're ready to rock.
All right. Thank you both for being with us, and Merry Christmas to you.
Merry Christmas.
Help Monday, a monthly presentation here on Daybreak, presented by Marble City Pharmacy. More Daybreak coming up right after this.